I just want to say this coffee is really good.
I don't care if I wait 20,000 hours. I still have the floor. And just because everybody else wants to.
You know, they're recording now. Hey, they're recording.
I don't care. I hope we get this on record that Mr. Heckman should wait till I'm ready. We have a whole minute to go.
I can't believe there's not more. It feels so like.
Yeah, I don't know. There's a lot. I should be allowed to have as much applause time as I want when I speak. Or do I have to speak nonstop?
What's that sound?
Non-stop. You can't pause. Too much can happen in a pause.
Well, that's what you expect.
Respect the pause.
Respect them in a pause.
Oh my God.
We're recording.
I know, we've been recording.
We're recording.
We all know. I know.
I'm letting it go.
Heckman cannot cut me off. It is now 6:30. May we begin? Welcome to the August 19th, 2021 Northampton County Council meeting. Mr. Myers, will you please lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Stephanie, please call the roll.
Kathleen.
Mr. Kusick.
Present.
Mrs. Ferraro. Mr. Giovanni.
Here.
Mr. Heckman.
Here.
Mr. Lott.
Here.
Mr. McGee.
Here.
Mr. Myers.
Here.
Mrs. Wargo Hefner.
Here.
Zirinsky.
Here.
All present.
Thank you. Can I have an approval, motion to approve the minutes of August 5th, 2021?
So moved.
Second.
Mr. McGee and Mr. Myers, all in favor?
Aye.
Any opposition or
I
amendments?
abstain because I was absent.
Okay. Is there anyone for courtesy of the floor? Hearing and seeing none. Mr. McClure, do you have a report?
Tonight you are considering, once again, helping small businesses heal the hurt that they're experiencing from their inability to hire and from the fact that their base of consumers have not returned to their pre-pandemic levels. And I believe you have about $624,000 in grants before you tonight. And I think it's just very important that we continue to support small business. As we all know, we're not out of the woods yet. And it's just extremely important that you pass that tonight so we can get that money out onto the street. Also, I think it's probably time to announce that on September 1st, we will open up the grant process to businesses who have previously received rescue funds, specifically funds from our CARES Act program. If you were a grant recipient, you are now authorized to apply for an American Rescue funded small business grant in Northampton County. So those folks that we threw that lifeline to in the CARES Act last year, we're now going to help them thrive this year by making them eligible once again for another grant. Mr. Cusick referenced the resolution regarding the proposal from the Department of Health to raise the PPD in nursing homes in Pennsylvania from 2.7 to 4.1. I am extremely gratified the County Council is going to consider that resolution. I hope you unanimously pass it and send it to everyone you can think of to send it to. I will report that myself, Jennifer Stewart King, Administrator of Graysdale, and Dawn Tweers-Feldman, our Director of Nursing, had the opportunity to give testimony to two senators from the minority party who sit on the Human Services Committee about the challenges that Graysdale would face if we had to immediately rise to the 4.1 PPD level. I think the senators were, now two senators in a minority party, it's just a start, but I think the senators were deeply moved by Jen, specifically her conviction about needing to be there for those Medicaid patients who have Alzheimer's and dementia, who literally have nowhere to go. And the point we made to the senators was going to that PPD overnight in this environment will put homes like Graysdale and Cedarbrook out of business. It's an existential threat. So one of the things the senators asked us was, well, what would you like us to do? They said, we're going to 4.1 eventually, but how, is there a way we could get there? And we're going to make specific suggestions to the state Senate, one being that we stagger the implementation of the 4.1. And a period of 5 years was suggested, in a process of thinking out loud, a period of 5 years to get to 4.1. And also the issue of funding arose. And Senator Haywood asked us, well, what would we need in terms of funding to help implement the process to move to 4.1? And I said it would probably be about a third of our payroll. I said probably about $12 to $15 million annually as a preliminary number to get us to the 4.1. So I wanted to report that we're engaged in that process and that we're moving forward. As you saw in the news, we will soon be mandated at Graysdale to have all of our employees vaccinated. That's going to be a requirement passed down to us through CMS, and that will be, we haven't seen the full, because I don't think CMS has actually written the guidelines yet, has written the regulations. But if what we hear coming from the president is you will risk your Medicaid reimbursement if your employees are not fully vaccinated. And as we all know here, Medicaid is the bulk of the dollars, bulk of the revenue that Graysdale takes in, so we do not have a choice. Everybody who works at Graysdale will need to be vaccinated, and they will be. That concludes my report.
Thank you. Does anyone have any questions or comments from Mr. McClure? Mr. Lott.
Yes, thank you, Mr. McClure. When we open the American Rescue Plan Act, that money again, when we reopen it September 1st, is that only reopened for people that got the CARES Act, or does that also open for the people, because there was people on a waiting list that just started getting from the American Act. So does that open up to anybody the second round, or is that only for people?
So I think we're envisioning that, so you're saying we just took care of that backlog, right? Is that what you're saying?
Well,
So there was a backlog after the CARES Act. We ran out of money. We have satisfied that backlog now. So are you asking, will they be then eligible again?
Yes.
I think what we're envisioning administratively is those folks wait until, obviously we're still going to prioritize new businesses, as new businesses will still be applying, but we have enough firepower in the remaining money to take care of the new businesses and to satisfy the businesses who received CARES Act money. But I think the folks in that no man's land, if you will, they probably need to wait toward the end, but I think there'll be plenty of funds for them as well.
Great. So clarifying, September 1st, it's open to anybody that didn't get CARES or American Rescue Act, or people that have previously got the CARES Act.
That's correct.
Thank you very much.
And I think that we'll continue to the extent possible. Mr. Barron assures me that he can do it. New businesses will be prioritized first, then businesses who were not in that on that backlist, and then the backlist business.
And another question on the mandatory vaccination. Did they give us any indication how we deal with somebody? I mean, are they going to write that in?
The law is very clear on who is entitled to exemptions. I take religious liberty very seriously. We take conditions medical conditions that would not permit you to be vaccinated very seriously. Human Resources is preparing in consultation with the solicitor's office as we speak to answer all of those questions, but I can tell you, they will need to be legitimate exceptions that the law would recognize, otherwise you're getting vaccinated or you're leaving Graysdale.
You will be, they will no longer work at Graysdale?
That's correct. You
Or
have to
will
be
they be
vaccinated.
furloughed, or
They're gone.
they're gone?
Yep.
Thank you.
Ms. Zirinsky.
Thank you. So, I had a question about, you said new businesses. Does that mean businesses who hadn't applied before?
Correct.
Or
That's what I
new
mean.
businesses that are just
No,
starting?
no, no. They still need to meet the criteria, but businesses who haven't previously applied
Okay.
and meet the criteria. They can be a new business within the last year, but
Okay.
yeah.
So my other question is, what was the total amount given to businesses and how many businesses were there? There was like over 1,000, right?
Well, so the CARES money was about 10.7 million, and I don't know, we've given away, how much have we given away in this?
Like 3 or 4.
Yeah,
3 or 4
between 3 or 4 million so far out of American Rescue.
to small businesses.
Yes.
And it was like over 1,000 businesses.
Yeah, we're well over 1,000 now.
Mr. McGee?
Yeah, I'll bring this up during the resolution, but, and I know you, I understand now you're in full support of Mr. Kusik's resolution, but some of the items you brought up tonight that was discussed with some of the legislators that you met with, the minority party and whoever else you met with, I kind of think that maybe some of that stuff should be in the resolution as well, because if we're telling them to do something, we should be telling them to do something in the direction that we like to go, instead of just telling them we're not in support of it.
Well,
It's almost like, show me the solution then, so, instead of just that there's a problem and we're not supporting it.
well, so we are supportive of 4.1. We want a 4.1 PPD. We just can't achieve it, not in the near term.
And-
It's just so, part of how I expressed it to the senators was, we'll breach it. We'll have no choice, and then the Pennsylvania Department of Health who's in Graysdale just about every other day, will have to determine what to do about that. And, there's a horror laundry list of things that happen to you as you violate, and the Pennsylvania, let me be clear, the Pennsylvania Department of Health has been really wonderful to Graysdale throughout the pandemic. It's been amazing how responsive they've been and how understanding they have been to the challenges that we face at Graysdale. Because remember, these are the poorest of the poor and the sickest of the sick, and they have nowhere to go. If Graysdale wasn't there, they would literally die in the street.
No, it's
And
just-
that's not hyperbolic. That's a fact. And so I'm doing everything and have been since I took office, but specifically through the pandemic, to make sure Graysdale stays county-owned. And we cannot have a 4.1 PPD go into place in 2022 that we can meet. It's not going to happen.
I agree with that. And my only suggestion was some of the things that we want the state to think about should be in the resolution. So we're telling them exactly what we would look to see to be in there. That's all. Thank you.
That's between you guys.
Any other questions or comments? Mr. Myers?
Just one, it seems to be a movement nationally that folks are going to be required or they're going to lose their job. Is that the way that's the way the president's presenting it right now to anybody with Medicaid? Am I correct?
In healthcare settings, that's correct.
Because we already have the two large.
No, look, I want to keep them all, but I also want to keep them, their families, and their residents safe. I mean, I think we've seen enough death and dying. And, when we were going through it initially, and we did all those things we did, nobody did the things we did. Nobody created a whole new isolation unit. Nobody did that. We did that. Nobody closed before we did. Nobody had the PPE that we had and had it as widely distributed and often used, and we still experienced all that death and dying because we didn't really have the tools that could stop that. We haven't had a death from COVID-19 at Graysdale since April 30th, and that is entirely related to the vaccination and the masking they do, but mostly the vaccination.
April 30th of this year.
Yes.
The only thing I want to follow up and make sure we're still correct, are we still testing at the Emmerich place?
Oh, yeah. So we're testing and doing vaccinations there.
And that needs to be, Jeff,
We're not
put
going
back out that we're still testing Mr. Reporter.
We're not going to stop.
I want to make sure it's crystal clear that we're still doing it.
We're not going to stop. If you need to be vaccinated, just go online and sign up. You can drive up, get a vaccination, wait 15 minutes, and you're done.
And people can still go get their shots.
Yep, and they can get tested there, too. Yep.
Thank you, Mr. McClure.
Do we know what percentage of the staff there is unvaccinated?
Well, we do know that approximately 55% of the Graysdale staff is vaccinated. Is 55.
Even with the incentives.
There's still 55, yes. Correct. Correct.
Lamont, may
We
I-
still have,
oh,
sorry.
It is
I was
not, it's,
pausing.
I didn't cut you off, I just, no.
He was speaking. You know, and working for one of the two large hospitals, I know that we were not at 100% either. So, you know,
well, but
it's not, and it's not an easy number to achieve, even if you are in the healthcare industry. And again, for some of the reasons that you've proposed, but.
the hospital systems are doing better than we did. But
All the offshoots of the hospitals, you can't go in unless.
Mr. Heckman.
No, I'm just going to ask, what the residents, what percentage of them are vaccinated? Because I know we have people, like you said, that we may actually have some immunocompromised people who may not be able to get the vaccination out of
Yes.
Graysdale.
correct, about 95%.
95%.
And
the one-
most of them are choosing not to be vaccinated. They are younger, tend to be younger male residents who are choosing not to be vaccinated.
Are we, despite, their decision, are we taking steps to sort of keep them, you know what I mean? Because even if you're vaccinated, they're not sure that you can't give it to someone. So I know they're choosing not to get it, but at the same time,
They're not isolated, Mr. Heckman.
so,
They're on their floors and they're free to move about their floor. And
all right. I was just curious how
That's their
that was
home.
working. Yeah, yeah.
I had a question. Go ahead, Mr. Lai, I had a question, but I'll get to it. Go ahead.
And I read in the paper today about that the bonus is probably going to go out now that it's being mandated. Have you picked a time frame, or is that just kind of, let's see how many people show up now that they have an option? I mean,
that's up to Ms. Stewart King to decide when she puts an end to that, but it definitely ends when the mandate takes effect. So,
Once that mandate kicks in, that's definitely out.
Yes.
Very good. Thank you.
More
That's what I
incentive.
kind of was asking.
yep,
I just received an email that they were offering the third shot for immunocompromised people. Has that begun at Graysdale?
yes. Just about everybody there is
So
immunocompromised.
they've already, you started to offer the third shot?
They're moving toward that very quickly. Everybody's going to get a booster that wants one. Yes.
Anybody else? Thank you, Mr. McClure.
May I suggest a brief executive session
You can suggest it, because I was just about to
to
call it, so
discuss
thank you.
litigation?
Yes, let's do so. It is what time? 6:46. I need a motion. Who motioned? Carrie motioned, Tara seconded. All right. No. okay? We entered in 6:46 PM for the reason of discussing potential litigation. We've returned at 6:56 PM, and no action was taken. Is there any old business? Seeing and hearing none, we have new business. We'd like to, first, introduction of an ordinance entitled, "An Ordinance of the Northampton County Council authorizing the County of Northampton, Easton, Pennsylvania, to lease approximately 2,650 rentable square feet of space at 1710 Butler Street, Easton, Pennsylvania, from Helen Garofalo and Helen Beth G. Vilsack." I need someone to sponsor
I
the
like this-
ordinance, Mr. Meyer.
I'd like to sponsor it since it's in Easton.
Anyone second? The public hearing, debate, and possible vote will be held at the September 2nd, 2021 meeting. Next, I have the introduction of an ordinance entitled, "An Ordinance of the Northampton County Council authorizing the County of Northampton, Easton, Pennsylvania, to lease approximately 2,500 rentable square feet of space at 136 South Main Street, Nazareth, Pennsylvania, from the Borough of Nazareth." I need a sponsor for this, Mr.
I'd like to sponsor
Cusick.
that. It's in my district.
There you go. And would you like a second? How about TG, because I saw him try to sneak in on the last one. Indicate the public hearing, debate, and possible vote will be held at the September 2nd, 2021 meeting. You're going to have to get louder down there, Mr. G.
I know.
Consideration number 3 of reappointments resolution area agency on aging authority. Mr. Heckman, will you introduce the resolution?
Would be my pleasure. All right. It is hereby resolved by Northampton County Council that the following individuals shall be confirmed in their reappointments as indicated hereafter. And these would all be terms expiring 6/30/23. To the Area Agency on Aging Advisory Board. Reappointments: Elaine Arntz, Easton, PA; Mary Jane Long, Easton, PA; Mary Jane McAteer, Easton, PA; and Paul Nagy, Hellertown, PA. This was discussed in detail at our committee meeting. Was that yesterday or today? Yesterday, sorry. They run together.
Okay, thank
So
you. Is there
moved.
any discussion regarding these appointments? Let's call for the vote, please.
Mr. Heckman?
Yes.
Mr. Giovanni?
Yes.
Mr. Lot?
Yes.
Mr. McGee?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky? Mr. Cusick?
Yes.
Mrs. Ferraro?
Yes.
Passes with a vote of 9-0.
Okay, next we have the consideration of personnel reclassifications resolution, Department of Human Services, Children, Youth, and Families Division. Mr. Heckman, will you introduce the resolution?
Yes. It is hereby resolved by Northampton County Council that the position of Fiscal Officer 1, pay grade HS 38A-2B, salary $52,166, in the Department of Human Services, Children, Youth, and Families Division, shall be reclassified to the position of Fiscal Technician Supervisory, pay grade 8 HS 33-6F, salary $49,920, effective the 20th day of August 2021. It is further resolved by the Northampton County Council that the position of Accountant 1, pay grade HS 35-3C, salary $47,770 in the Department of Human Services, Children, Youth, and Families Division, shall be reclassified to the position of Accountant 2, pay grade 30, HS 38A-1A, salary $49,920, effective the 20th day of August 2021. And I would like to add that this also was discussed in detail at the committee meeting. So moved.
Any discussion or questions? Mr. Myers?
Just a question. These are supervisors, you're making these supervisors. These weren't supervisors before, correct? They were just positions.
No, they actually are both supervisors, Mr. Myers. One of them
The position that is being downgraded is a supervisor, and her title is going to say supervisor now.
So the previous position was supervisor too?
They were both supervisors. They're just, yes.
And we're not losing any supervisors in this?
Nope,
Okay,
they're both non-union positions,
okay. Just
and
wanted
will
to
stay that
clarify
way. Yep.
Any other discussion or questions? Okay, let's call for the vote.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Mr. McGee?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Kusick?
Yes.
Mrs. Ferraro?
Yes.
Mr. Giovanni?
Yes.
Adopted by a vote of 9-0.
Next, we have the consideration of personnel request resolutions, Department of Human Services, Children, Youth, and Families Division. Mr. Heckman, will you introduce this?
It is hereby resolved by the Northampton County Council that 5 full-time positions of caseworker 2, pay grade PS 35, 1A, salary $41,060, total salaries $2,005,300, be created by the Department of Human Services, Children, Youth, and Families Division, effective August 2021. It is further resolved by the County Council that 1 full-time position of clerk typist 2, pay grade PS 27, 1A, salary $29,157 be created in the Department of Human Services, Children, Youth, and Families Division, effective August 20th, 2021. It is further resolved by the Northampton County Council that 1 full-time position of Social Services Aide 2, pay grade PS 27 1A, salary $29,157 be created in the Department of Human Services, Children, Youth, and Families Division, effective August 20th, 2021. It is further resolved by the Northampton County Council that 1 full-time position of casework supervisor, pay grade HS 38B 1A, salary $49,920 be created in the Department of Human Services, Children, Youth, and Families Division, effective August 20th, 2021. This was also discussed in detail. So moved.
Any discussion? I have a question that I didn't ask last
Sure.
night.
No, I was going to do the same thing. The numbers aren't right. Right?
Would you like to go first?
No, you paused.
There's mutiny here. Regarding civil service, because again, I have no opposition to creating these positions.
Yep.
My concern is your ability to fill them with the difficulty that we've had with civil service. So where are we in that process?
We are still in the process of getting out of civil service, but even within civil service, we are able to fill positions. Some of the policies of 90-day right of returns and whatnot make the length of time we have to wait be part of what carries on the difficulties in filling multiple positions at one time. But we have more positions filled today than when I started here, and we've added more positions, and some of those are filled, some of those are vacant, and we'll continue to fill them, and when we're out of civil service, they'll mostly be filled.
Yeah, I know I've listened to some of those tedious meetings, and they are also, everybody's trying to work to make it happen. I understand that, but.
Yep.
And I think that was the only question I had, was the civil service question.
Okay.
Mr. Lott?
Yes. I hate to do this, but I wanted to read it again, and I'm not quite sure I'm right. This is the last resolution we just passed. Both salaries are $49,920 on August 20th day of August. I thought one of those positions rolled back, the other one rolled up to 49, the other one rolled back to 47. Am I missing something on that resolution?
It was the one
That
you
was the
just,
previous
the one you passed previously.
The one we just passed, that's what I'm
Yes.
talking about. Didn't one of those salaries roll back?
Yes.
And one roll forward?
Yes.
Am I reading this resolution wrong? They both are getting $920 on August 20th. Am
I
I
don't-
reading that wrong?
No, you're not. First one was 52,000.
Oh,
Yeah.
okay,
Yeah.
okay, I apologize, and thank you for explaining that.
Oh, no
So
problem.
the first,
Thank you, Linda.
The first one.
the first one was at 51,
52.
52, and rolled back to 49. Thank you for the explanation. I knew one rolled back, and it looked like we were paying the same. Thank you.
Gotcha.
And the other question was the clerical, there's no somebody that we're hiring that's going to be able to assist these people in doing the tedious amounts of paperwork that they are doing?
Well, that's part of what we've restructured some of the clerical positions to do just that, so that we can, since the paperwork is not going away, we have found portions that clerical staff can do to help. And for example, if a caseworker takes all their notes in the field and they're, either handwritten or they are spoken into the, not recorder, because that's dating myself, but electronically somehow, then the clerical staff can do the dictation on those and type those out for them. So those kinds of things that we're really trying to make it more efficient for the caseworkers to have more time to do casework.
And the same thing with the aid position, the driver that you talked about,
So-
that's all legal, they're all vetted, they're allowed to do transport, they don't
Yep.
need a caseworker with them.
Nope, correct.
So it's
All
not a double
clearances are
duty.
done, trainings are done that have to be done, and, correct.
Thank you.
You're welcome.
Call for the vote.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Mr. McGee?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Kusick?
Yes.
Mrs. Ferraro?
Yes.
Mr. Giovanni?
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of adoption of Department of Human Services Pay Scale Resolution. Mr. Heckman, will you introduce this resolution?
Should I just do the be resolved?
Please.
Now therefore be it resolved by the Northampton County Council that the 2020 and 2021 Human Services Civil Service non-union administrative staff pay scale and the PSSU employees pay document referred to as Exhibit A. The 2021 revision shall be retroactive to July 1st, 2021. And we discussed this yesterday. This is something that just happens. It comes down, the state revises the pay scales, and we in turn then revise ours in terms of reimbursements, and that's it. So moved.
Thank you. Any discussion? Call for the vote.
Mr. Heckman?
Yes.
Mr. McGee?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Kusick?
Yes.
Mrs. Ferraro?
Yes.
Mr. Giovanni?
Yes.
Adopted by a vote of 9-0.
I didn't vote.
I'm so sorry, Mr. Lot.
Yes.
How soon they forget?
She was just pausing. It's okay.
Oh, not applause.
What's the count? Consideration of the American Rescue Plan Funding Resolution. Mr. Lot, will you? I'm going to separate.
Whereas on March 11, 2021, the American Rescue Plan Act 2021 was signed into law and is intended to combat COVID-19 pandemic, including public health and economic impacts. And whereas Northampton County was awarded an allocation of approximately $30 million of American Rescue Plan funding to spend on various relief efforts. And whereas the Grant Review Committee comprised of Northampton County Department of Community and Economic Development staff and county administration convened to review and make funding recommendations. The recommendations totaling $348.25 for 48 projects are attached hereto and made part hereof Exhibit A. Now, therefore, it be resolved by the Council of the County of Northampton, number one, that the recommended grants in Exhibit A are approved. Two, that the county exec of the County of Northampton is authorized to execute any and all necessary grant agreements with the applicants not to exceed the approved amount for each grant. So introduced.
Thank you. Any questions or discussion on this matter?
It was discussed in the Finance Committee last night in length. Thank you.
Okay, and thank you to DCED and the Chamber as well as the committee for all the hard work that they've been doing to date, because it makes the process very seamless. Call for the vote.
Mr. Lot?
Yes.
Mr. McGee?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Kusick?
Yes.
Mrs. Ferraro?
Yes.
Mr. Giovanni?
Yes.
Mr. Heckman?
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have the consideration of a donation of landscape stones resolution. Mr. McGee, will you introduce this, please?
I'd be honored. Whereas Northampton County Home Rule Charter, Section 20210, provides that the county council shall have, among other, the following powers: to accept on behalf of the county any gifts of real property and to provide for the acceptance by any agency on behalf of the county of other gifts. And whereas Bradford's Lawn Service is donating landscape stones that will be delivered to the Hilltop Landscaping Products by Hilltop Landscaping Products to be painted by the Northampton County Suicide Prevention Task Force and placed in county parks as part of the National Suicide Prevention and Awareness Month in September. Now therefore be it resolved by Northampton County Council that it does hereby accept the donations of stones from Bradford's Lawn Services. So moved.
Thank you. Mr. Heckman, would you like to make a comment?
Yes, and I just want to say, we had a involved, what? Oh, it's on. Okay. We had an involved discussion about many things at our Human Service Committee meeting, and this sort of got shuffled off to the side, and I just wanted to give it its due. And I don't know, I know you wanted to say something, Ms. Wondolowski, then, and sort of cut you off because of all the folks and wanting to move them on. So, I mean, this is wonderful. We appreciate this so much, and the company, and we want to shout out, for them, and go ahead.
Yeah, so,
I'm sorry, ask the president if you may go ahead.
yeah, please speak.
It's not Mother May I, of course you can, yes.
Thank you. September is Suicide Prevention Month, so we have a lot of activities planned. In fact, one of them is Iron Pigs at the ballpark on, I think it's September the 1st. We're sponsoring the game with American Foundation for Suicide Prevention, so it'll be some Jumbotron stuff, some radio stuff. So that's the big thing, but Robin Barbosa came to me with the idea of the rocks that I'm sure all of you have seen around town at some point that are painted with, kindness, either drawings or words on them. And so we are going to do that. I think there's going to be about 500 small rocks. And last year we did luminaries that our DHS staff decorated and we put on display in the building. So this year we'll do the rocks and display them there for a while. And then if we can find a safe way for the landscaping crew to work around, maybe we'll put some at the parks. And if not, we'll have a really nice display at DHS and maybe some at Graysdale. So that's what the donation was for.
Thank you.
Extend our thanks
Will do.
to everybody involved, please. I'm sorry.
Thank you.
Anything else? Call for the vote, please.
Mr. McGee?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Kusick?
Yes.
Mrs. Ferraro?
Yes.
Mr. Giovanni?
Yes.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Adopted by a vote of 9-0.
Thank you. Next, I'd like to take number 11 because I believe it's easy and quick, and then we could go back to the other two that might have more discussion. Consideration of Administrative Code Article 13 contract resolutions. The first is NPC Inc. Mr. McGee, will you introduce the resolution? Sure. Yeah, but there's two. NPC Inc. Yep, that's it.
Whereas Northampton County Administrative Code, Article 13, Procurement and Disposition of County Properties, Section 13.15, Contracts and Agreements. Number 1, requires approval of county council for any contract exceeding $100,000, which was awarded using the competitive negotiation after competitive sealed bidding, and non-competitive negotiation source selection methods. For contracts with renewal clauses, the entire potential payout, if all renewal clauses are exercised under the terms of the contract, must be considered when determining if council approval is necessary. And whereas on July 25th, 2021, the Northampton County Council received a request from the county executive for county council to adopt a resolution approving a contract in the amount of $108,224 $6.88 with NPC Inc. for election ballot printing services. Now therefore be it resolved that the Northampton County Council does hereby concur with the recommendation of the county executive as set forth in the attached documents to approve a contract with NPC Inc. So moved.
Thank you. Is there any discussion regarding this matter?
The discussion on this happened last night as well
Okay.
in the Finance Committee meeting.
Wasn't this Mr. Derringer explain this one to us?
Yes, sir. Call for the vote?
Mr. McGee,
Yes.
Mr. Myers,
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky,
Yes.
Mr. Kusick,
Yes.
Mrs. Ferraro, Mr. Giovanni,
Yes.
Mr. Heckman,
Yes.
Mr. Lot.
Yes.
Adopted by a vote of 9-0.
Thank you. Next, we have similar, one Tyler Technologies. Mr. McGee, will you introduce this
I'll
one?
start with the second whereas. Whereas on August 4th, 2021, the Northampton County Council received a request from the county executive for county council to adopt a resolution approving a contract in the estimated of $911,000 for 2022. I'm sorry, 2022, at $299,999. And 2023, $306,000, and 2024, $306,000 with Tyler Technologies for IsoWorld appraisals and tax software for a term of 3 years. Now, therefore, be it resolved that the Northampton County Council does hereby concur with the recommendations of the county executive as set forth in the attached documentation to approve a contract with Tyler Technologies. This was discussed last night as well, and this is software for doing the taxes, which is a pretty big part of the county.
Yeah.
Okay, discussion? Call for the vote?
Mr. McGee,
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky,
Yes.
Mr. Kusick,
Yes.
Mrs. Ferraro, Mr. Giovanni,
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Adopted by a vote of 9-0.
Thank you. Now we can go back to the consideration of opposition to Department of Health rulemaking 10-221 proposal resolution regarding long-term care facilities. Mr. Cusick, will you introduce the resolution?
Thank you, Madam President. Whereas the County of Northampton operates the largest long-term care facility, LTCF, in the state of Pennsylvania under one roof, and whereas the Pennsylvania Department of Health has proposed changes to rulemaking 10-221, which would alter the minimum number of direct care hours per patient at every long-term care facility from 2.7 to 4.1, and whereas current staffing levels in most long-term care facilities, including those in Northampton County, struggle to meet sufficient minimum, is that rolls? Rolls. And whereas the proposed change in hourly minimums does not take into account the difficult nature of the work at long-term care facilities, made more so by the ongoing pandemic, as well as fails to consider the additional regulatory and reporting requirements imposed and increased sanitization concerns for all shifts. Now, therefore, it is hereby resolved that number one, Northampton County Council opposes implementing this change and urges the Department of Health to reconsider the possible negative outcomes of this proposed rule. And two, a copy of this resolution and the attached letter shall be forwarded to the Independent Regulatory Review Commission, Pennsylvania Department of Health, and the Legislative Policy Committee chairs of the General Assembly.
Thank you, Mr. Cusick. Is there any discussion regarding this matter?
I have a question.
Yes.
And I was so focused on, with the meeting on the, what was coming up with our issues with the Housing Authority, I didn't really give as much attention to this coming up to today as I probably should have. I listened to what the executive said, and I'm reading this again, and I just like to make it, for me to be clear, this is tough for me because we should have more care. I mean, that's a good thing. I do understand the challenges, because that was pointed out to me by a council member, of fulfilling this. But the executive got up and explained that part of this is the idea that we'll be able to phase it in. So if I vote for this, I'm voting against providing more care for the individuals per hour. I mean, am I off on that?
You asking me a question?
Well, no, I'm asking Mr. Kusick, and then if I mean, I don't know.
Well, I think what we're trying to say here is, when this issue first came up, I brought it to the CCAP board, and there are still 17 counties that own and operate nursing homes, and all of them, on a bipartisan basis, indicated that this is simply not workable for us to achieve this by next year. So, yes, I understand that, of course, having more care is a good thing, but the way that the state is going about implementing this is not the best way they could do it. And the other piece that I didn't even mention is funding. There hasn't been an increase in the Medicaid reimbursement rate in years. So that's the other piece of it that needs to be considered. So in many ways, this is an unfunded mandate. So that's where I stand. I'd be glad to raise it to 4.1 if additional funding is provided and it's done in a more piecemeal over a course of time. What they're proposing is a change that would take effect next year. And for our situation, I don't believe that that's possible.
And this has come from the governor's office.
This has
Hasn't
come
gone
from,
to the legislature.
this is not a piece of legislation. This is a proposed rule from the Department of Health. What is currently going on is whenever a rule or regulation is proposed, there is a public comment period. Right now, we are in the public comment period. And what I've asked of the other counties that have nursing homes and this one is to chime in opposition. And CCAP was nice enough to provide us with a sample letter and resolution that we used as a template here. So yes, I understand perfectly. Right now, I think that I read somewhere only about a quarter of the long-term care facilities in the Commonwealth of Pennsylvania can meet this requirement. So I think it's well-intentioned, but from a practical standpoint and a fiscal standpoint, it's very difficult to implement.
And did you want another comment, or are you
Oh,
still
no, I'm
thinking?
still, I'm pondering.
You're
So far,
pausing?
there's others I'm sure that want to.
Ms. Wondolowski's here, and she may speak. Is PACHA the right acronym for the group that's involved in this as well? Because I was at CCAP, and we did discuss this as the potential legislation changes. And it's exactly as Mr. Cusick is intimating, that it's going to be a burden without extra funding and extra dollars. But do you have more information on this at this time, or no? No. And I know that we do a very good job, because we've talked about the therapies that we have coming in and how that does increase our numbers, but I agree with Mr. Cusick, we're not going to be able to meet this in their timeline. Mr. McClure, do you have other comment to make to this?
I am hopeful there will actually be legislation that addresses this issue before the regulation takes place. But if you're telling me, can I guarantee you that we can meet the 4.1 in 2022? The answer is no. And I can guarantee you that we cannot.
And the state, and they have not yet discussed what kind of repercussions that could mean if we did.
Well, they're the repercussions, you know.
Yeah.
There's,
But
there's
they haven't discussed
citations,
them
there's
specifically.
provisional licenses, there's appointed administrators by the state. There are all these until ultimately, you lose your license.
Okay, all right, I understand.
But I agree with you though, Mr. Heckman. We want there to be 4.1 PPD. We're not against that. What we're saying is it doesn't comport with reality on the ground. And,
I heard your
they're not,
testimony where you said, you told them, would you please, we'd love to do it, but we'd like to phase it in. And I guess I'm a little confused.
but they're not thinking
not
about,
writing it
see,
that
they're
way.
not thinking about Graysdale and the Lehigh and Cedar Brook and the Lehigh Valley. So at any given time, there's about 1,000 or more people living in our facilities, Graysdale and Cedarbrook, many of them with dementia and Alzheimer's, and most of them on Medicaid. So you're talking about, at any given time, hundreds of people that would end up in our prisons, that would end up on the streets, that would end up in the hospitals, and you know, when the hospitals don't like extended stays. So there is literally nowhere for these people to go.
Right.
And if they forced us to live to that 4.1, we could not do it, and it endangers those people.
All right.
So a very well-meaning regulation, actually in the short term, will endanger lives in the Lehigh Valley.
All right.
That's what we told them.
The road to hell is paved with good intention.
It's great, and, you know, maybe in 5 years with $15 million a year from the state, we might be able to get there.
All right, I get a better handle on everything now. Thank you. I'm done. I'm finished.
Thank you. So I understand that there's a push to have an increase in per-patient hours, but again, it's an unfunded mandate given to us by the state, who once again tells us and dictates that we should do certain things, but without increasing funding. And it would be a good idea, but I'm wondering if when we say at the end, a copy of the resolution and the attached letter shall be forwarded to the Independent Regulatory Review Commission, if there's somewhere in that letter we can state how we think that this is a good idea, but it should be phased in, and that money should be allocated to counties with nursing homes to increase that.
Well,
That's something-
if I might, Madam President?
Yes, sir?
There's a comment period that's open right now. Council's free as individuals, as a body, to go in there and comment as well.
So as an individual.
You can comment.
We can comment.
Yep.
Okay, I think I did see that in the email, and I will definitely do that, and I will reiterate these talking points. Thank you.
Because we're going to comment as well.
Okay, great.
Mr. McGee?
Thank you. I appreciate Mr. Cusick bringing this to our attention. It's time sensitive, I understand that. I was a little hesitant. I still think that the resolution's missing a couple of things, because if we're sending it as full council, you know, we should send the solution too. Like, you know, the solution. The solution is, we need more funding. It might be in here, but it's not clearly identified. We heard some numbers tonight of maybe what some of the projections are. And the other thing was, you know, it's not achievable, it's just mentioned here, that's here, good job. The other thing I heard tonight, though, is, you know, the time frame. You know, because I agree with Mr. Heckman, and him and I did discuss this, you know, in the private sector, you know, I know some folks out there that, you know, they're struggling, trying to keep up with their demand, patients, you know, they have the money, you know, they don't, so here, it would probably close shop up from what I'm hearing tonight. So, you know, I understand the, you know, how soon we have to get this in here. We're in that period. I just thought, since it's coming from full council, since we heard a couple of things tonight, maybe he didn't realize that or whatever, we heard it tonight. They did talk with the legislators that are, you know, working on this proposal, so. I'm going to support it, and then maybe Tara's suggestion of, because you got to give them the solution, you know, and apparently you guys did verbally, but it's always nice in writing and from a bigger group, so.
Madam President, may I? They did invite us to prepare a solution, which Graysdale administration is working on now, both in terms of timing and in terms of funding. And we're going to be providing that directly to them and as part of our comment, and of course, we'll give it to council as well.
Mr. Cusick, are you interested in adding or amending this in any way to add that, or?
No, I'm glad to hear that. I think that, you know, I wanted to keep this generic, and this came from a template. So, I mean, if we want it to be more specific, the public comment period is until the end of the month. So if you look back in your CCAP email or go to the CCAP website, it references the emails for the Independent Regulatory Review Commission, the Legislative Policy Committee chairs, and the Department of Health. So if you had additional comments that you wanted to submit on top of what we're already doing, that'd be great. So,
So you're comfortable as it stands?
I'm comfortable as it stands, and I've heard some great suggestions here, and I'm thrilled that the administration is working on a positive solution.
And is,
But-
how soon, Mr. McClure, can we get that data if we wanted to make individual comments as well? Because obviously we have like a week and change.
So the timeframe is, we're looking at a 5-year horizon, but I want to make sure Mr. Dunlap has enough time to make sure the money is right. I mean, because we think it's about a third of the workforce. So, and that's pension and benefits as well. So we need to, I can't give you an answer tonight, I'm sorry. Within a week or two, I think Brian will be done.
I would just ask that he share any of that with council as soon as it's,
As soon as it's done, you will receive it.
because then people could use that to craft their own letters as well.
As soon as it's done. And Ms. Wondolowski's probably texting people right now, telling them to get that done.
I do see that. Thank you very much for everyone.
If I had a guess, their spaghetti's being interrupted.
Mr. Kusick, when is the time period over for the submissions of the?
August 30th is the deadline for public comment on the rule proposed.
Okay, so this has to, and just to be clear, I just don't want to send the wrong message with not enough information on a resolution. Because, I don't want to send there's people out there that are looking for more care in these places, but we can't afford it and it'll close our shop. So I get that, the difference there. It's just, don't want to send the wrong message.
And I would just say, sir, you're absolutely right, but it's not just can't afford. There aren't the people for the jobs right now.
That's the other problem.
I mean, I think when we heard the recruiting presentation tonight.
That's the other
I
problem.
don't think anybody's ever done more to recruit than the Graysdale administration has done to recruit at Graysdale in the last couple of years. That's the problem too. There literally aren't the people. And one of the points the director of nursing made when we gave our testimony was it takes 2 years to make a nurse. So, you're just putting the people in school now who might come to us to help us meet those numbers.
Well, and not only, the fourth paragraph,
So you're right, sir, but it's not just money.
the fourth paragraph intimates that this is not only the work that they do normally, but the nature of the work, given the ongoing pandemic. They're assuming post-COVID. We are not post-COVID yet. This is what, the third wave of potentially 5? We have no way to predict this. So everything that's stated there is also a factor, not just day-to-day normal operations without funding. Mr. Myers, you wanted to make a comment?
I just wanted to chime in on the last thing that Mr. McClure said, because that was going to be my point. It's statewide that you can't get bodies. And Bill was just talking about us. It's everywhere. All the bonuses you're throwing out, people still ain't jumping on it. That's what's going to hurt us. We can't get the bodies. The money's one thing, but the bodies, you just can't get people to do it anymore. That was my point I wanted to make. That's why I'm going to be in favor, because I know how hard it is for the entire industry to do anything with it.
But if I may, to your point, though, it'd be nice if it was addressed here, because then they could understand clearly what we just talked about in our message. It's not shutting them down, it's that there's no bodies, we can't get the funding. It's a great idea, but, it's not feasible and it sets us up for failure. That's all.
I think the point that we could add that to it, we would just be repeating what I'm assuming Mr. McClure is going to put in his response. Am I right or wrong?
No, but
If you want duplication, fine. But that's going to carry as much weight because it's coming from Northampton County. It's up to what we want to do with it. It is what it is. It's an unfortunate situation.
I'd like to call for the vote.
Mr. Kusick?
Yes.
Mrs. Ferraro?
Yes.
Mr. Giovanni?
Yes.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Mr. McGee?
Yes.
Mr. Myers?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Adopted by a vote of 9-0.
Thank you. And last, we have consideration of resolution opposing House Bills 1232 and 1559 regarding truck sizes. Ms. Zirinsky.
Okay. Whereas the allowance of heavier trucks on our roadways increases safety risks to all Pennsylvanians, and whereas heavier and larger trucks cause excessive infrastructure damage, which causes taxpayers of Northampton County to cover such costs, And whereas the Transportation Advisory Committee, TAC, has completed a study as to heavier, larger trucks and concluded that additional exemptions should not be considered until a more thorough analysis of the safety and infrastructure impacts are completed. And whereas House Bill 1232 and House Bill 1559 ignore these findings of the TAC and Pennsylvania Department of Transportation, PennDOT, as these bills envision adding larger and heavier trucks to the roadways of Pennsylvania. And whereas the United States Department of Transportation in 2016 completed a study as to the impacts of larger and heavier trucks on roadways and recommended that there be no change whatsoever in current truck size and weight limits. Whereas this US DOT 2016 study concluded that heavier, larger trucks have a 47 to 400% higher crash rate. And whereas larger, heavier trucks are opposed by a large coalition of stakeholders, including but not limited to public safety advocates, law enforcement organizations, local government groups, and members of the trucking industry. Now therefore be it resolved that Northampton County Council opposes House Bill 1232 and House Bill 1559. A copy of this resolution shall be forwarded to all state legislators within Northampton County and additionally forwarded to Governor Thomas Wolf and Lieutenant Governor John Fetterman.
Thank you. Is there any discussion regarding this matter?
I just want to say that a similar resolution was passed by this governing body about 2 years ago on heavier trucks. This legislation is just coming back again. And so, as outlined here, we're just trying to keep heavier and larger trucks off the road, and I think everybody understands that in Northampton County, this is definitely an issue that we have here with the erosion of our roadways, with the current truck traffic that we have.
Mr. Myers?
I have reservations and questions because I have no idea what House Bill 1232 and 1559 are, and I want more time to look at what the hell they are. I mean, this is the first time I'm seeing it says today, you know, and what I'm concerned with with any bill at this point right now is Lehigh Valley Planning Commission brought huge companies in here, warehousing, that affects people's jobs. I mean, we're not in Lehigh County, but Wakefern Foods has a monster warehouse out there for ShopRite. Amazon, FedEx, there are lots of thousands of jobs. And our roads are getting the hell beat at them. Yes, I agree with that. You know, our roads look like, you know, they're getting the hell beat at them, but this is more for us to send to our state legislators to get off your ass and do something. This is, you know, it's a resolution, I understand this. But I want to know more about those two bills because it's the first time I'm seeing it. I haven't had a chance to look at what they're proposing. I'm not just going to jump on something that I don't have any, I'm being a dummy at. I've been down that path before. I want some more history on this myself. All due respect, I hear what you're saying, but I want to know more about what the hell, what are these two House bills telling me? That's all I got to say.
Thank you. Any other comments or discussion?
I think, if I may, just in fairness to Mr. Myers, what he's saying, I hear sometimes when we go asked to move on something, and I personally am opposed to the double law. I mean, I know they're out in Utah and that, and they're flying out the highways in Nevada. I don't see how that could work here. We're already in trouble. But there's a point to be made when you were talking is there are bills, and people in here have seen some of these bills that are from the state, have a page and page and page and page of this, therefore, whereas, and there's a lot in it. And this is part of some bill. And when we say we're opposed to a specific bill, even though you mentioned the trucks, we're also opposed to everything else in that bill because we're saying don't pass it. Now, I don't know if there's extra money in this bill or not. Now, so I understand where Mr. Myers is coming from in the sense of we just talked about the road to hell is paved with good intentions. I'll be honest, I'm totally opposed to tandem tractor trailers. In fact, I saw one
on 78, and I didn't think they could come through here, but the wind hit it, and it almost put me into the side of the road. So I mean, I think it's a bit much, especially in a heavily populated area like here. But I do understand where he's coming from, because there's been times where bills can be loaded with all kinds of stuff, and let's say there's funding in this bill somewhere. I don't know. I just wanted to point that out. He makes a valid point on that regard.
I think when I think of bills like this that are being passed, I think the people who are trying to pass them don't realize where these trucks are trying to navigate. If you ask Fiorella Mirabito about the trucks that go through Bath and go over the sidewalk without any regard to the children who are walking on the sidewalks to schools or at bus stops, and if you've tried to even get your car through Bath, I mean, there's some turns there that are just a little bit difficult. And we have that kind of traffic in the Lehigh Valley, where we're trying to get the trucks that are allowed on the roads now to navigate through our roadways. These bigger, heavier trucks are a danger. And also the fact that we are saying that this is going to cost taxpayers more because of the road damage, I think we all realize like how much road damage there are. And the budget for PennDOT went down for our roads. So we don't have as much money to repair them. So where's that money come from? That comes from our taxpayers, and we have a responsibility to do what's best for them and to keep our roads safe. And yeah, we have all these warehouses. The trucks that we have here now, if you've driven on 22 or 78, you realize sometimes it's wall-to-wall trucks. And if you're sitting there in a little Prius next to it, you definitely feel it. You know, car goes off to the side a little bit, you're walled off because you have trucks all around you. Sometimes they're at a standstill, and these larger trucks, it says right here, 47 to 400% higher crash rate. How many times have we seen the trucks that are on the roads now crash? And what does that cause in the repercussions to the lives of the people involved, to the traffic and the time that everybody, to our first responders who have to go out to these calls? This is all a responsibility that I think we have to take, and this is in Pennsylvania. This is a law that's being passed here. So I take this seriously because I think about the people who have come to me with their concerns about the traffic in their neighborhoods. And I know that a lot of these trucks don't just stay on the main roads. They use their GPS sometimes, their personal GPS, to take a back road, to take a shortcut. And a lot of times that's up 611 or up a narrow street or through Bath. And so I think it's important that we pass this, and I understand you haven't read these House bills, but this is a similar legislation to the one that this body has passed before.
Mr. McKee.
Yeah, I'm glad you brought it to our attention. I also understand Mr. Myers' comments. I just gonna make a suggestion. I think if we're ever proposing a resolution with House bills, I think that we should get the House bill come with us when the resolution comes. That way, when we open our email, we got the two attachments, the two House bills, and the resolution. And if some of us have free time, we can read that over before, or we could do a little search. That way, because I remember we had another issue on another bill, I think, and I said, hey, I didn't have a chance to, or even Mr. Kusik's thing with the thing we just voted on tonight. I'm sure there's something there, right?
There's a there.
What would that be called? It's not a bill.
It was a Department of Health proposed rule
Okay,
change.
so that could have been in our resolution, and then we would have saw it, right? PDF, right? Paperless thing.
Sure.
I'm in support of this, and I agree with everything you're saying, and I hear it from people too. And I also hear Mr. Myers saying he didn't have a chance to actually look at what these bills are, and Mr. Heckman is, because, be honest, and to keep going here for a little bit, Mr. Giovanni had brought some things up too that I thought were really good with like warehouses and infrastructure banks, and maybe some of these truck companies can be paying that, or maybe paying some of the freight for something, not sure, because of the damage of the roads, or, anyway, okay, that's all I had, thank you.
Sure. And I'll say, when Mr. Cusick brought his resolution to my attention, just in the email, I Googled, what was it? The proposal number. Yeah, the rulemaking 10-2021, and I read through it. When I get things like this, I often say, oh, House Bill 1232, what is that? And I understand out of convenience, it's probably easier if we attach them from now on.
Out of
But-
respect, I guess. Out of respect for everybody's time.
Sure, not a problem.
More work for you guys. Mr. Lott?
Yes, you know, I sit here and listen and think about this, you know, who likes heavier trucks, who wants more trucks? I don't know anybody out there that would agree with that. But that being said, you could make the argument that if you put heavier trucks on the road, you would have less trips because you're having more cargo shipped out on a truck. So you'd have less trips. Less trips mean less traffic. Less trips means less greenhouse emissions, less environmental emissions. So there's that side. Now, I think that's, if I was arguing for it, that'd be my argument, that you're gonna have less trucks on the road because you have heavier trucks. I don't think by any means that outweighs the safety factor. Those trucks that are right now, what they weigh, they're very dangerous coming down the road, and I don't think people realize how dangerous those are to stop and maneuver. But I just don't see that fact outweighing the fact of the safety for our citizens and for the cost of our citizens. Unless those truck companies want to pay a lot more and they're fighting this gas tax, they're destroying our roads with heavier trucks. And if they want heavier trucks, they're going to do more damage. So to me, it's almost a no-brainer. I look at both things, and the only thing I could see as a positive is less trips, less pollution, but I just don't, I can't see where that overrides the safety of this and the damage to the road. Thank you. So I'll be supporting this.
Thank you.
Mr.
I don't-
Myers?
I'm sorry.
Just a point of order. I'm not opposing this thing for the safety standpoint. I spend 8 hours a day driving people around. I see a whole hell of a lot of trucks. And I'm carrying precious cargo who's trying to get life-supporting things. I'm taking people to dialysis. And it scares the hell out of me when I'm sitting there and driving somebody around and the entire vehicle gets moved around. I'm not fighting that point. I'm not. What I'm saying is very simple. We got to stop, what I'm agreeing with Billy, we got to stop sending shit to us that we can't read and know what the hell we're going to battle. And I'm not going to sit here and try to talk proper. I'm a kid from Southside. I'm going to tell you like it is. I'm not going to jump on something if I don't know what the hell I'm voting on. And that is the problem here. We bring resolutions up and we don't know what we're looking at. And that's bad. It's very bad. And it's half-hearted. If you're going to bring something up, bring up the facts so we know what the hell we're voting on. I'm not opposing this. What I'm saying is we've got to do it the correct way from this point on, or otherwise, what are we doing? We're voting blindly. So don't sit here and say that I don't have concerns, because my wife will tell you till she's blue in the face that she goes nuts every time she goes on the road in a car with me because she can't stand tractor trailers. I hear it every day. But we need to make sure we know what the hell we're voting on. That's the point I'm saying. Just because there's a House bill, I don't know what the hell is in a House bill. That's my point. Well, after that, I'm all for it.
So as a point, I'm sorry, did you, go, please, Mr. Lott, go ahead.
I just, you know, I'm listening to Mr. Myers, and I hear what he's saying, except for the fact that we get our council agenda on Monday sent to us. And I just want the public to know that. So we have Monday we get it late in the day, so we won't count Monday. We have a couple days to ask for more stuff. We have a couple days to do our research. So I understand what you're saying, but it isn't like we're totally blocked from doing this stuff ourselves. I mean, this stuff was sent to us Monday afternoon, Mr. Myers. So I think, it's part of our, as council people, to dig into these things when we have to. So I respectfully disagree. I think we do have time, to Mr. McGee too. And I think we do. The way we're set up, we get our agenda on Monday. I believe if we have questions, we should be reaching out on Monday, hey, to the sponsor, whoever sponsors this thing, we should be reaching out or talking to other council or talking to our employees and saying, hey, I need more information on this. So I'm just saying that to the public. We are not handed to this blindly. Thank you.
Well, I've counterbalanced that, okay? My whole life is not Northampton County. And I don't think anybody else's is Northampton County. There are other things in life that we do for people,
Okay, knock it off down there.
okay? I'm not going to beat this horse to death. What I'm just simply saying is, I'm asking, okay? And you can say, oh, yeah, you had all the time in the world. Okay, I'm glad you do. I just don't happen to.
So from a procedural perspective, you have two options. You have the option to vote. You have the option to table and get more information. I have not heard a motion for tabling. Therefore, I will call for the vote. I need a motion and a second on the table.
I'll make a motion,
For
not to table. Look, what are
Not-
we making
no,
a
you
motion
don't-
on?
not
You don't need
to-
to make a motion if you,
Oh, I thought we were making a motion for you to call the vote. I
no,
was
no, no,
like,
no, no, I could just
sorry,
call it.
I'm a little,
I'll
like-
repeat myself. You have two options. I can call for the vote, or if you want more information, you can make a motion to table and second it. I hear
for the
no
vote.
motion to table,
Call
so
for
we
the
will
vote.
call for the vote.
But are we going, here's my motion, and has nothing. Further, in the future,
You can't make a motion in the middle of her.
Fine.
You could do that after the fact.
Mr. Myers,
Am I
I
correct
hear
in that
you,
procedure?
and I will include the House bill next time and make sure that it is attached as a PDF file, even before we get the memorandum. But I hear you, I understand what you're saying, and I respect that. Thank you.
Well, you want to make sure it's the right version, too, of the bill, or the right, whatever, reading or text, or whatever they call it.
I'm calling for the vote. There'll be no further discussion. Ms. Shupnisky.
Ms. Zirinsky,
Yes.
Mr. Cusick,
Yes.
Mrs. Ferraro,
Yes.
Mr. Giovanni,
Yes.
Mr. Heckman,
Yes.
Mr. Lot,
Yes.
Mr. McGee,
Yes.
Mr. Myers,
yes.
and Ms. Vargo Hefner.
Sure.
Adopted by a vote of 9-0.
Thank you, everyone. Is there any other new business to discuss?
Heck, no, didn't we do it?
Can't leave yet.
Yeah,
County Council.
Madam President.
Yes, sir.
Just real quickly, I just wanted to take a minute to note the passing of District Judge Brocious. She's someone that has served in a role as a MDJ as well as a long-term employee of the District Attorney's Office. And I think we should thank her for her service and offer condolences to her family. Thank you.
Absolutely. Thank
Here,
you.
here, and and as far as the human services side of things, she was very, I don't know what to say, except that she was really like one of the most forward-thinking when it came to the DA's office and the child abuse, sex investigations and pushing children's issues. And you're right. I agree with you on what you said, Mr. Cusick.
Good point, thank you.
County Council, committee reports. Any reports? Ms. Zirinsky?
We had an Energy, Environment, and Land Use Committee committee meeting today, and at that meeting, Becky Bradley and Jeff Reese and their intern, whose name I forgot, gave a compelling presentation about the global watershed study and what's going on at the LVPC to mitigate climate change. Then I also wanted to say that we are actually doing more than Lehigh County. We're at 83% mitigation, and Lehigh County's at 74. And I thought Percy Doherty would really like to know that. We also went over regenerative agriculture and what the county and the conservation districts are doing with cover crops on 2 properties at Graysdale. That's it. Thank you.
Thank you. Mr. Heckman.
Yesterday, we had a personnel committee meeting, and we voted on it tonight. And tonight, we had a human services committee meeting. We talked about the Oliver Border Home and some of the issues that we're facing with that. And we talked about the information we received, or lack thereof, from the authorities. And we also heard from Graysdale on their efforts to recruit. It was very, very enlightening, very interesting. And I guess I could say that's about it. Thank you.
Mr. McGee.
Yesterday, we had a finance committee. The county controller came in and gave litmus of reports, all his findings. There was about 8 reports. I actually have my paper in my desk there, but he went through a lot of the hotel tax audits that he did. And we had 2 items here, the 2 of the contracts that we talked about tonight.
Okay. Council liaison reports. Mr. McGee.
Lehigh Valley Planning Commission had their executive committee today, and one of the discussions they had was they're understaffed, and they need to take a look at staffing issues. They compared it to other counties and staffing issues in other counties, and I think I don't want to throw a number out there, but considerably understaffed compared to other counties is the message that I got from the executive session. So that's all.
Anybody else? Liaison? I have one, and Mr. McGee and Mr. Heckman can help me with this, and Mr. McClure probably forgot because he has so much else going on, but on August 2nd, the pension board met, and we voted to refresh the pension fund for the OPEB, I believe?
Yep.
OPEB members. Effective date?
January 1st.
January 1st of next year. So there will be, now, you all have to help me with this. What's the amount? There's an amount that they get. Is it 12?
12.5.
12.5 will be refreshed for all OPEB members and their family members?
Yes.
Okay. Just wanted to say it right. So that was big news, but it kind of gets lost in all the other dilemmas that we have with masking. But I think it's a real coup for the pension members, and it speaks to the health of the fund, and the money is there, and there's no better way to use it but give it back to the people that deserve it. So the board voted unanimously to do so. Did you want to add?
No,
Mr.
no,
Heckman?
the health, I think it was important to note the health of the fund, because people get nervous, well, if you're doing this. So we have the money in the fund. It's done very well. It's being managed very well. And as you know, some of you, the lifetime benefit business was ended, I think, about 10 years ago. So now it's more actuarially possible to figure out where we're at with who's eligible, who isn't. And I think now more than ever, you can get a better accurate figure, and I'm sure Mr.
So just
McClure-
really quickly, 524 million in the pension fund and about 55 million in OPEB. Did I have that right? So we're very well funded.
I would
It's
say
nice to
we're-
see Mrs. Wedge here, back at the helm to help us
We're
get
one of
that
the
done.
best funded.
Council clerk report, I'm sorry, Peg?
I just think the county should be commended for this OPEC, because from day one, I think they realized that, and much more so than other counties. So I'm happy to say we're in a good position They should be complimented.
Peg, if I'm not mistaken, the information we got is, from our staff, is that we're actually one of the best municipal governments. There's so many out there that are underfunded, and we're in really good shape.
Right, and I mean, that was years ago when I was on the pension board, so I'm glad to.
So, and Council Clerk, any report? Council Clerk needs your agenda items by when for the next meeting? Because does that run up against Labor Day? No, it's pre-Labor Day, never mind. All right, and Council Solicitors report?
It's been a long night. If you'll give me 20 seconds to indulge me, just to follow Mr. Kusick and Mr. Heckman. Judge Brosis was terrific. I worked with her in the DA's office. She was a servant to the people, and she had the good fortune to be married to John Ryback, who, like her, was committed to families and children and youth as the guardian for about 25 years prior to his death. And they have 3 beautiful children, and may they rest in peace, and we hope that their memory is their blessing. Thank you.
Thank you. And just one announcement that the Finance Committee members on September 2nd will be meeting to discuss the RFP entries that we've received regarding our
Outside auditor.
our auditor for the next few years. May I have a motion to adjourn?
Motion.
But Giovanni got there first. Gio in the house and Meyer second. All in favor? Bye.